it all goes back to appearance, and the functionality of appearance is the critical part, because a person that comes to see me, it depends on what they do and what they need out of their appearance. A businessman, for instance, if he's getting older or she's getting older, they need to be able to compete with their younger colleagues. And so what we try to do is figure out on each person's face what I call bad fenders. It's a nice car, it's not brand new, but there's some part that is out of proportion with the rest. It could be something hanging down under here, or excessive jowling, or something that makes them look much older. Just as a nice car with a bad fender, you wouldn't feel like driving it around. I use that analogy a lot. So that's what I look for, are those types of things, not to redo the whole car, but just to get everything so it's balanced and you'd have a non-operated look that way. And it's not distracting. For a professional person, it's very distracting if there's a part that is out of proportion to the rest. It's like having a piece of egg on your face in a business meeting. People can't concentrate on what you're doing, and so what we want to do is make all the parts of a person's face balance so you don't have any distractions from what you're trying to say. That's why your face is the most functional part of our person. We don't really realize that until something goes wrong with it, but if it is just like the egg analogy, can totally disrupt a person's business meeting, or an attorney, a preacher even. People quit listening to what you're saying. So that's what we try to do. And in normal plastic surgery, which people don't really see, because the good stuff you don't notice. You only see the ones that are not done that way and overdone. It's like, I always say that evaluating plastic surgery by the media is like deciding about air travel if all you saw were the crashes. And unfortunately, that's what you mostly see. But what we do is try to make it invisible and fix the bad fenders and keep it so people don't know. They just think you had your hair changed, or you lost weight, or you just really look good. And so that's the object in good plastic surgery. Facial rejuvenation is about subtleties. It's about how we perceive, how we look at each other. I always say that we want to keep the other person looking at your eyes, because that's the best place to be looking, and we want to make that be the focal point. The rest of the face is something the brain perceives in the blink of an eye. It doesn't really study the rest of it, so we use that to our advantage. We want to keep the rest of the face so that the brain doesn't really want to go look there, especially places that are difficult to treat. As we get older, the neck is a difficult area because it loses a lot of its elasticity, and there's only, in a lot of people, there's only so good you can make the neck look. But if we can make it so that it's below what the other person perceives, so that their eyes don't drop down and look there, then we've won. Then we've got it so they keep looking you in the eye. That's where you look. The rest of the view is something the brain does quickly and just doesn't notice. It's all about, what does the other person perceive or notice? And if we can keep them looking at the parts we want them to look at, then we've won. And so that's the goal of aesthetic surgery, is to have the other person be attentive to the parts that we want them to look at. And that's why looking in the mirror, when we look at ourselves in the mirror, we don't look that way. We look at the parts we hate the most. And so we end up concentrating on things that other people may not even see. And you can, if you don't watch out, you can spend a lot of money, a lot of risk on parts that are not really useful. It doesn't really help. So that's what I help my patients try to understand, is it's all about what do the other people notice.